Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this particular session, I'll be just giving you a brief review on the very important topic, that is acromegaly. So first of all, you should understand what exactly you mean by this word acromegaly. Acromegaly is a clinical condition which is characterized by increase in growth hormone. And this particular increase in growth hormone, if it occurs in adults, that we call it as the acromegaly. And the same increase in growth hormone, if it occurs in children, that will result in gigantism, right? That will result in gigantism. So the difference in between gigantism and as well as acromegaly is the age of the individual, but the pathology is same, that is increase in the growth hormone. Then followed by that, you should know what are the tissues that are being affected in acromegaly. So the tissues which are affected in acromegaly are both, that is the soft tissues are affected and the skeletal tissues are also being affected, right? So these particular soft tissues which are being affected include like the spleen, kidney, liver, heart, and as well as the skin. These are all the soft tissues which are being affected. Whereas if you take the bony abnormalities, that includes the bones of the extremities that are being affected. Next, so this will be the characteristic phase that you will see in patients with acromegaly, where you have the presence of broad coarse facies, and you also have, you can observe the protrusion of the jaw, which is nothing but prognathism in patients with the acromegaly. Next, what is the most important cause of the acromegaly? The most common cause of acromegaly will be mainly pituitary adenomas. And what type of pituitary adenomas are those? That includes the somatotroph type of pituitary adenomas. Right, that includes somatotroph type of pituitary adenomas, and most of these somatotroph type of pituitary adenomas, they are usually macroadenomas. What do you understand by this word macroadenomas? That means the size of the tumor will be more than 10 mm, right? That is what you mean by this word macroadenoma. The size of the tumor will be more than 10 mm. That is the most common cause. Next, what are the rare causes of acromegaly apart from your pituitary macroadenoma? The rare causes include, the ectopic tumors that produce growth hormone releasing hormone. So growth hormone releasing hormone is actually the hormone which is being produced from hypothalamus. But certain ectopic tumors can produce GHRH, which will stimulate anterior pituitary to produce excess amount of growth hormone. And less than 1% of them, they are malignant. So these are certain rare causes of the acromegaly. Next, followed by that, what is the age at which the growth hormone excess occurs in acromegaly? So growth hormone excess occurs in age group around 3 to 5 years, right? At the age group around, I'm very sorry, please correct this. So the next important question is, what is the age at which the growth hormone excess occurs? Growth hormone excess occurs mainly around 3 to 5 decades, that is around 30 to 50 years of age of the individual, the growth hormone excess occurs. Then next important question is, what are the clinical features of acromegaly? So if you observe the clinical features of acromegaly, you have the skeletal manifestations and as well as the soft tissue manifestations. Like you take the skeletal manifestations. Skeletal manifestations, mainly you will observe that in the extremities, where there will be enlargement of the hands and as well as the enlargement of the foot. Now, because of the enlargement of the hand, there will be increase in the size of the glove. And because of enlargement of the foot, there will be increase in the size of the shoe. and even the head circumference is also increased, and that is the reason why the size of the hat is also increased, and the finger size or the diameter of the finger is increased, so that is the reason why your ring size is also increased. So that is what is the skeletal manifestations that you will observe in patients with acromegaly. Now, what are the abnormalities of the faces in acromegaly? So abnormalities of the face, if you observe, there will be portioning of the facial features, and there will be presence of the broad nose, enlarged nose, and if you observe the mandible, there will be protrusion of the mandible forward, and that we call it as the prognathism. And even within the mandible, there will be wide separation of the teeth. Right, there will be wide separation of the teeth. So this will be the facial features in patients with the acromegaly. And even if you observe the voice in these individuals, they have a deep voice, and that is because of enlargement of the vocal cords. Right, that is because of the enlargement of the vocal cords. Next, what are the skin changes in patients with acromegaly? If you observe the skin changes, there will be increase in the skin fold thickness, and there will be also hypertrophy and hyperplasia of the sweat glands, and that is the reason why there will be increased sweating in patients with the acromegaly. Next, what will be the respiratory manifestations in acromegaly? See, there is increase in the soft tissue even around the respiratory tract. That is, the soft tissue of the chest wall is also increased. That can cause the compression of the respiratory tree, and that is the reason why the individual can develop obstructive sleep apnea. So that will be the respiratory manifestations in patients with acromegaly. Now, what internal organs are affected in acromegaly? That means which are the important visceral organs? The important visceral organs which are affected includes the heart, which is a very, very important structure, and lung, spleen, liver, and as well as kidney. So all these internal organs, they are enlarged in their size. Next. Followed by that, what will be the skeletal manifestations in acromegaly? See, there is enlargement of your bones that we have already discussed, right? Where there is increase in the breadth of the hand, there is increase in the breadth of your toe, and that is the reason why glove size and as well as shoe size is increasing. But apart from that, the other skeletal manifestations include the development of osteoarthritis and entrapment neuropathy. So because of the soft tissue surrounding the nerve get compressed, and that will make the individual to develop what is called as the carpal tunnel syndrome. So in patients with the carpal tunnel syndrome, there will be compression of the median nerve. Right, there will be compression of the median nerve. These are the skeletal manifestations in patients with the acromegaly. Next. Then, what are the menstrual irregularities that you will observe in patients with acromegaly? See, we have one important etiology which will cause acromegaly, that is called mammo-somatotroph type of pituitary adenoma. So, in case of mammo-somatotroph type of pituitary adenoma, there is increase in the prolactin levels, and there will be also increase in the growth hormone levels. And because of increase in the prolactin levels, that will make the individual to develop amenorrhea. So there will be menstrual irregularities, and that will be in the form of amenorrhea. And why is that? That is because of prolactin secretion. Next. Now, what are the cardiac anomalies that you will observe in patients with acromegaly? See, in acromegaly, there will be abnormal enlargement of the tissues within the heart. There can be hypertrophy of the septum particularly, and that will make the individual to develop the hypertrophic obstructive cardiomyopathy. There can be development of hypertension, and these individuals will also develop congestive cardiac failure. So these are the cardiac anomalies that you will observe in patients with the acromegaly. Now, they are more prone for arrhythmias as well, right? They are more prone for arrhythmias as well. Okay, next. Now, what are the metabolic changes that you will observe in acromegaly? Metabolic changes, it includes, there will be effect over the glucose, blood glucose level. So where the individual will have the hyperglycemia. Why? Because growth hormone is a diabetogenic hormone, and growth hormone is the one which will increase the hepatic gluconeogenesis. So that is the reason why, you know, there will be impaired glucose tolerance and as well as the development of diabetes mellitus. So these are the metabolic changes that you will observe in patients with the acromegaly. Next, what are the neurological features in patients with the acromegaly? So most of these etiologies causing acromegaly, that is nothing but your pituitary macroadenoma. The size of the pituitary macroadenoma is more than 10 mm in diameter, or more than 10 mm, that is more than 1 inch. So I'm sorry, it is more than 1 centimeter. So these macroadenomas, they can compress the surrounding structures, or they can raise the intracranial pressure, and that is the reason why there can be headache because of raised intracranial pressure. And because of the compression of the optic chiasma, there can be development of visual field loss as well. So these are the neurological features that you will observe in patients with the acromegaly. Next, what is the most common cause of death in acromegaly? Most common cause of death in patients with acromegaly, it includes the cardiovascular mortality. And this cardiovascular mortality, it could be because of congestive cardiac failure or because of coronary artery disease. Why coronary artery disease? Because in patients with acromegaly, there is accelerated atherosclerosis, and that is the reason why there can be development of coronary artery disease. Then, how do you diagnose the acromegaly? See, in the diagnosis of acromegaly, we have the first line investigation and as well as the best investigation. So out of which, what will be the best initial test? What will be the first line investigation? First line investigation is that where there will be increase in the insulin-like growth factor 1 level, which is nothing but somatomedins. So IGF-1 is nothing but your somatomedin. And where is this somatomedin released from? This somatomedin, it is released from liver. So growth hormone will go and act on the liver, and liver will produce somatomedin, and somatomedin is the one which will show the physiological actions of your growth hormone. So in acromegaly, there is increased growth hormone and there will be increased somatomedin levels. But what is the confirmatory test for your acromegaly? So if you observe the confirmatory test for acromegaly, that includes the failure of suppression of growth hormone in spite of giving the glucose load. You see what will happen. You give 100 grams of glucose, right, orally. When you give 100 grams of glucose orally, what should happen to the growth hormone levels? That should be suppressed. It should be less than 5 nanograms per ml in a normal individual. But in acromegaly, in spite of giving 100 grams of glucose, the growth hormone will be more than 5 nanograms per ml. That is what is confirmatory, suggestive of the acromegaly. And followed by that, next important question is, which particular parameter correlates the disease activity? Okay, before that, previous question. So in the previous question, you should know that the confirmatory test, in a normal individual, whenever you give the 100 grams of glucose load orally, there should be suppression of the growth hormone in a normal individual. But in acromegaly, there is failure of suppression of the growth hormone in spite of giving the glucose load. Now, which particular parameter correlates with the disease activity? So the parameter which correlates with the disease activity will be insulin-like growth factor 1. So more severe is the disease of acromegaly, more will be the IGF-1 levels or more will be your somatomedin levels. Right? So the parameter that correlates with the disease activity is IGF-1 levels. Now, what are the imaging studies in acromegaly? See, the most common cause for acromegaly is pituitary macroadenoma. So, in order to diagnose that pituitary macroadenoma, you need to do the MRI of the brain. So, when you do MRI of the brain, that will help you to make out the tumor, right? So, MRI is preferable, but even you can do the CT scan as well. This will document the size of the tumor. Then, what is the management of patients with acromegaly? Remember, first line management in patients with acromegaly will be surgical resection of the tumor. And in what way you will do this surgical resection? Transsphenoidal surgical resection of the tumor. So, you see here, the objectives are mainly to decrease the growth hormone level to normal, stabilize or decrease the tumor size, and preserve the normal pituitary function. That is the objective. So the primary treatment in order to reach that particular objective will be surgery, and that particular surgery will be transsphenoidal surgery that will provide the rapid response. So this will be the ideal management in patients with acromegaly. Then followed by that, what will be the complication of surgery? See, what are you doing in this surgery? You are doing transsphenoidal surgical resection of the pituitary. So almost 10 to 20% of individuals, they will develop hypopituitarism. This will be the complication of the surgery. Next, which drugs are given for acromegaly? So in those individuals where surgical management cannot be done, in them you need to do or you need to give medical management. Now, what will be the first line drugs or what will be the drug of choice in patients with the acromegaly? So, the drug of choice in patients with acromegaly will be somatostatin analogs, and these somatostatin analogs include octreotide, lanreotide and paclitaxel. So, that will be your somatostatin analogs. These somatostatin analogs, they reduce the growth hormone levels, right? And they also cause the tumor suppression, which one? The octreotide and as well as the lanreotide. Next, among this octreotide and lanreotide, octreotide is the best medical therapy for acromegaly. Now, apart from somatostatin analogs, what are the okay? But before that, what are the adverse effects? Yes, what are the side effects of somatostatin analogs? Side effects of somatostatin analogs include cholestasis, and that will lead to the development of cholecystitis. That will be the side effect of the somatostatin analog. Then, what are the alternative therapies apart from this octreotide? So, in those individuals who have developed cholecystitis, you cannot give this somatostatin analogs. The other drugs, they include the dopamine agonist, that is bromocriptine and as well as cabergoline. These drugs, they are preferably given in mammosomatotrope type of pituitary adenoma because the prolactin levels can be reduced by your bromocriptine and as well as cabergoline. Then followed by the dopamine agonists. What are the second line agents in acromegaly? Second line agents in acromegaly will be pegvisomant. So, what is the mechanism of action of the pegvisomant? See, it is a growth hormone analog. Which one? Pegvisomant. It is a growth hormone analog, and that will antagonize the endogenic growth hormone by blocking peripheral growth hormone binding to its receptor in the liver. That is what is your pegvisomant, which is a second line agent. And what if surgery and medical management does not work? What is the next line of management? Next line of management will be radiotherapy. This radiotherapy is used only when surgery and as well as drug therapy do not work. Then you do the radiotherapy. But the problem with the radiotherapy is slow resolution of the disease. And hypopituitarism is seen in 20% of patients when you are doing radiotherapy. So that will be the last line of management. If surgery and medical management does not work, we do this radiotherapy. And finally, what are the complications of acromegaly? Complications of acromegaly, it includes compression of the surrounding structures by the tumor. That includes visual abnormalities. That includes the visual abnormalities in the form of bitemporal hemianopia. Then there can be development of the congestive cardiac failure, and this is the most common cause of death as well. Other complications are diabetes mellitus and then cord compression. Why diabetes mellitus? Because growth hormone is a diabetogenic hormone. It increases the sugar levels. Cord compression because of increase in the breadth of the vertebra, and that can cause the compression of the cord. And finally, the visual field effect, that is in the form of bitemporal hemianopia. So this is in nutshell about this very important topic, that is acromegaly. Thank you very much.